Okay, welcome back. So the two of you seem so happy. Is there anybody that helped you along in this process?
Yes. Our nurse, Nutella. She was wonderful. She was a true hero. She gave us so much information. She taught us what we can do, what we can't do, things we should avoid. She was amazing.
So some of the non-pharmacological interventions would include healthy eating habits, so avoiding refined carbs and curbing your caffeine intake. And it's also important to eat vegetables, greens especially. Eating fish and switching protein sources is important, and experts at Harvard Medical School actually say that replacing a serving of meat each day with a dairy protein or vegetables such as beans, peas, soybeans, tofu, or nuts can actually boost fertility. Also, taking prenatal vitamins is important. Now, weight loss contributes to infertility as well. It's important for obese women to lose weight to help boost their chances, and exercising and avoiding alcohol, tobacco, or drug use can promote fertility. And stress relief activities such as yoga can help the woman relax. And on the side there, you can see some top 5 yoga poses for infertility. And engaging in other activities and hobbies to get your mind off of the fact that you're trying to conceive, so it happens.
Okay, well, I have a surprise for the two of you. Yes, your nurse, Nutella, she is here with us in the studios. Let's bring her on in.
No. Oh my God.
Okay, have a seat here. So, Nutella, you clearly had a great impact on them. How did you help them along in this process?
So, first of all, it's great to see you guys. So first, when the testing began, we first started with the non-pharmacological treatments. We tried to change their lifestyle, so we tried to break the unhealthy habits by implementing, how to exercise and eat healthier, because we know that being overweight is a common risk factor for infertility. And so the next thing we did is that we tested ovulation through body temperature and ovulation test strips. And the last thing we did is that we checked for the position of the cervix.
Wow, and did all that work?
So at first it did not. So then we turned to the pharmacological treatments, and after that, we'll see what happens.
So some of the pharmacological interventions would include Clomid, which is a trade name for the generic clomiphene. And Clomid is an oral tablet that is taken either days 3 to 7 or 5 to 9 of the menstrual cycle, and it's an ovulation-inducing agent. The next step would be the hormone injections, and these medications are given either through IM, so intramuscular, or subcutaneous. And over 90% of women can have ovulation induced with this type of therapy. Now, intrauterine insemination, which is the IUI, involves placing sperm inside a woman's uterus to facilitate fertilization. And the goal of the IUI is to increase the number of sperm that reach the fallopian tubes. And another way a pharmacological intervention would be through surgery, and that's actually to restore fertility. So issues such as endometrial polyps, uterine septum, and intrauterine scar tissue can be treated with stereoscopic surgery. And the last one that we have listed there is the in vitro fertilization, so the IVF. And this is actually where the doctors manually combine an egg and sperm in a lab dish and then transfer the embryo to the uterus.
yeah, our nurse Nutella here, she was great. She hooked us up with a geneticist, genetic counselor, a pharmacist, and a fertilization specialist, you know, for our pharmacological needs and just our medical care.
Right, so since the cause for infertility was unknown, the drug we gave was clomiphene, which basically stimulates the eggs in the ovaries to get released. After that, we saw that that was unsuccessful, so then we gave hormone injections, and after that, that was still unsuccessful. Then after that, what we did is we did an IUI, which is intrauterine insemination, where we basically collected sperm and we concentrated them to increase the chances for insemination.
Wow. So what an amazing story. The conclusion after this short break.
Come this Thursday to see the University of Hawaii as they put on an interpretive dance of when fertilization goes wrong. Here's a sneak peek.
I'm a sperm. We're a sperm. She's a sperm, because we're all sperm.
We're an egg. We're an egg. We're an egg. And we're an egg. And welcome back, folks. Let's hear from Bo and Finn about their emotional distress involved. And I'm sure other struggling couples can relate and realize you're not alone.
Yeah, it's true. At first, I was so depressed. After not being infertile for so long, I just felt like a failure. And the worst part was, we were fighting all the time. We were blaming each other for the whole thing.
I was losing hope. We were fighting all the time. I didn't have energy. I couldn't go to work. I mean, I thought my cojones were broken. And we even contemplated divorce. Pero no.
So there are a lot of therapeutic coping mechanisms that a couple could undergo when they're experiencing infertility. They could join support groups to realize that they're not alone and that they're not the only ones going through the struggle. They could see a therapist and go to couples therapy so that they could hopefully increase their emotional state during this hard time. They could also just have general education about the matter and also pursue other interests so that they're not constantly focused on their infertility issues. And it's also important for them to engage in stress relief activities such as yoga and meditation.
I'm so sorry to hear that. So how are you guys able to work through this difficult time?
Well, I'd say we owe it all to our nurse, Nutella. She was so wonderful in this whole process. She provided us with the education we needed. She even introduced us to the couples therapy program. Oh, that was wonderful. It was with other couples, and they had infertility issues, and it was great.
Yeah, so since infertility is a life crisis and is one of the most common problems that a couple will face, we basically guided them to focus not on like blaming themselves, and not blaming each other. And because approximately 1 out of 7 couples, they will experience infertility, and so it's actually much more common than you think.
And thank you so much for coming in today and sharing this touching story. You guys have some exciting news, right?
We do. We're pregnant.
And it's twins!
Hi, Mom.
Okay, folks, that's congrats. That's all we have time for today.